So the Tendyne device is a very unique transcatheter mitral valve implantation device, and this is delivered transapically. I think the unique feature about this device is that it has two components. It has a circular tri-leaflet valve, and it has an apical pad which is connected via a tether to the valve itself. What makes this unique is the fact that the sealing and the anchoring of this device are different, are separate. The sealing occurs because of the frame which is around the valve, and the anchoring of the device occurs because of the tether which is connected to the apical pad. I think that's a very unique design of this valve. It's also completely repositionable, it's retrievable, which provides a lot of safety in complex mitral valve implantation cases. So the largest experience with any TMVR device was with the global Tendyne feasibility study, which was recently completed, and the one-year data was presented by Paul Saraja and his colleagues and published in JACC. The results actually were very promising. The device had a very high implant success rate of 97%. The mortality at 30 days was low at 6%. The one-year survival was very high at 72%. And really, during the procedure, there was no need for cardiopulmonary bypass. There were no procedural deaths. There was no need for ECMO during the procedure. The safety of the procedure was high. And the durability of success in terms of reduction of MR was very high as well at the end of 1 year. So majority of the patients were left with no or trivial MR. And symptomatically, these patients improved significantly. So the durability of the results and the safety of the device were confirmed in this feasibility study. Yeah, the field of TMVR is rapidly evolving, as you know. There's a number of devices on the market. Some of them are transapical, some are transfemorally, transeptally delivered. And there's a lot of debate about whether the future of the field is going to be transeptal or transapical. I will say that based on the excellent results that we have received with the global Tendyne feasibility study, this study has really set the bar high in terms of any other device to compare in the space with. There's also talks about the potential role of the Tendyne device in patients who have severe mitral annular calcification. Some of these patients were treated as compassionate use criteria previously, and now there's a separate Tendyne and MAX study which is underway, which is approved for enrollment of up to 30 patients. 6 of those patients have been enrolled as of last month with very promising results. 0% procedural mortality, high success rates, no LVOT obstruction. So I think it still remains to be seen whether the future is transeptal or transapical. We know that transapical Tendyne implantation comes with a very high success rate. And I think there's some promising data in the use of the Tendyne device in mitral annular calcification patients as well.